Next is Senator Moses Kajwang.
Mr. Speaker, I rise to support the amendments to the Tobacco Control Act as proposed by Senator Catherine Muma. Mr. Speaker, if you look at the global dynamics of regulation and control of e-cigarettes across the world, Africa has been a free-for-all. It has been a market where anyone can come in with electronic cigarettes, anyone can distribute them, and there are no regulatory barriers. There are no strict regulatory requirements. As a result, Mr. Speaker, our children have found it easier to access e-cigarettes, much more easier than it is to access the traditional cigarettes. It is becoming a serious problem, and those of us who are parents, sometimes we hear stories in boarding schools that children are sneaking in with e-cigarettes. They're very difficult to detect. They do not emit the traditional smoke. You know, in the old days, if you had some naughty boys smoking cigarettes in the toilets, the pungent smell of the cigarette would call in the teachers immediately. But with e-cigarettes, it is very possible for people to smoke, for children to access these products without consequences being meted upon them. Mr. Speaker, Senator Muma has made proposals to ensure that electronic nicotine delivery systems are regulated and that advertising of tobacco products is regulated and that the sale of tobacco products, including electronic nicotine delivery systems, to persons under the age of 18 is prohibited. And further, Senator Muma has proposed that these electronic nicotine delivery systems should not be manufactured, distributed, imported, or sold in Kenya without the prior authorization of the Cabinet Secretary responsible for health. Mr. Speaker, this is necessitated by the current situation where the markets are open and anyone can bring in these electronic nicotine delivery systems without paying taxes, without their quality being vouched for, and without the health impacts being looked at. Mr. Speaker, there are countries that have placed outright bans on electronic nicotine delivery systems. One such country is India. India has said, no, we are not going to subject our population to this novelty. Another country that has put in very tight restrictions is Australia. And in Australia, some of these electronic nicotine delivery systems are classified as therapeutic solutions, such that to access them, you will need a prescription, and you can only access them from a pharmacy. Other countries, Mr. Speaker, have imposed a blend of restrictions, ranging from age restrictions, ranging from advertising restrictions, and even content restrictions. In Kenya, we have not had any restriction whatsoever. And so it has been a wild, wild west when it comes to abuse of this novelty. Mr. Speaker, we must take a multi-pronged approach to this particular subject. One of the greatest ironies is that Kenya is a producer of tobacco. And tobacco growing goes on in Western Kenya, particularly Nyanza, and more so the areas of Migori, especially the areas around Kuria. Tobacco is a big economic crop there. And so you find that 36,000 farmers, according to latest reports, rely on tobacco growing for sustenance. And about 13,500 hectares of land has been put under tobacco cultivation. Mr. Speaker, perhaps we need to have a conversation on how to transition these communities to healthier products, because in any case, it has not been established that tobacco growing has led to wealth and has increased the lot of those who practice tobacco growing. When you move around those areas, you can stare poverty straight in the eye, and yet you have farmers who dedicate and break their backs trying to produce tobacco, which eventually ends up in certain value chains that mess up the health of our people and put an inordinate burden on the health systems in this country. And so, whereas we could argue that we produce tobacco in Kenya, but it is possible to transition our farmers into healthier products. And Mr. Speaker, where tobacco grows, sunflower can grow, a lot of other products like soya, avocado, etc. can grow. And I believe, Mr. Speaker, that the best solution is not to have policemen running around with rungus and handcuffs, running after tobacco smokers, but to have a comprehensive policy that is designed to prevent and designed to address the root causes of tobacco consumption and tobacco abuse in this country. Mr. Speaker, the tobacco lobby is extremely strong. I've been in this parliament and I've seen instances where we have made proposals to amend the Tobacco Control Act, and you'll find people who work for the tobacco companies hanging around the parliamentary lounge, hanging around the parliamentary restaurant, and trying to talk members of parliament against making certain proposals. They always argue that because of syntax and excessive excise duty that is imposed on tobacco products, that it is such a critical economic factor that we should not be interfering with it. But, Mr. Speaker, we must balance the economics with the long-term health impacts. I want to support this proposed amendment because ultimately we must put in regulation and we must prescribe a certain regulatory or statutory framework for these electronic nicotine delivery systems. Mr. Speaker, as we do it, we must also be conscious of certain trends that are going on that we might not be able to catch as Parliament and that we might not even be able to catch as parents. Mr. Speaker, marijuana has been illegal in this country for the longest time. Its consumption, its distribution, its sale has been illegal. And yet it is still widely available in the country. The chiefs know where it is, the administration police know where it is, and it has become a cash cow. The administrators at the village level, from the village elders all the way up, they know where the marijuana is grown. They know who the peddlers are. But because it sustains a criminal enterprise, we cannot be able to get rid of it. Mr. Speaker, young people have now transitioned from smoking it to eating it. There is an emerging trend of weed cookies, Mr. Speaker, that are easily found online, that are easily found in urban centers, easily found in entertainment spots. You are eating a cookie, you think it's just a normal cookie, and yet it is laden with illegal products and illegal substances that have got a dangerous effect on our health. How are we going to be able to catch up? How are we going to be able to keep up with our young people? How are we going to be able to keep up with the criminals who are intent on using innovative approaches to escape the established laws? Mr. Speaker, beyond the weed cookies, there is what they are calling e-weed. And these devices, the same devices that can be used to deliver nicotine electronically, can also be used to deliver cannabis electronically. And Mr. Speaker, we need to ensure that when we do legislation, it is as broad as possible. But ultimately, it is not legislation that is going to help us. We must reset our moral fabric. We must reset our moral compass as a country. We must ask ourselves, what are the underlying reasons that would drive a young person who has been in the church choir all the childhood ages, has been a pathfinder, has been an altar boy, and then all of a sudden, at the age of 13, 14, they decide to go into some of these activities, which the parents did not train them to do. Why? Is it because of overexposure to the media? Is it because of overexposure to advertising? Do we have advertising systems and advertising algorithms that trap our children into certain consumptive behavior? Mr. Speaker, the story is told of Japan. Originally, Japan was a tea-drinking nation. Japanese never drank coffee for a long time. And when the big coffee multinationals came into Japan, they were unable to penetrate the market. They were unable to sell. They got a child psychologist to develop for them an advertising campaign. And Mr. Speaker, what this child psychologist did was to try and put coffee in children's food from an early age. So you've got coffee-flavored infant formula. You've got coffee-flavored candy. You've got coffee-flavored chewing gum. And so children started getting the idea of the feel and the taste of coffee from an early age. It took only one generation, Mr. Speaker, for coffee to dominate as the biggest beverage in Japan. And it almost overtook tea. Why? Because they exploited the psychology of children. We must look carefully at even the advertising space in this country. Are we having adverts that are enslaving our children? And Mr. Speaker, it goes beyond what Ezekiel Mutua used to do when he was in the Field Classification Board, declaring something pornographic, declaring something ungodly. We must have scientific approach and scientific vetting of the marketing campaigns in this country, because I believe, Mr. Speaker, they make it look like it's cool to smoke, and so the kids want to smoke. When you look at Hollywood movies, Mr. Speaker, the star is always smoking. When you look at many of these sitcoms, you find a parent is smoking in the presence of children, and our children grow up thinking that it is cool, it is fashionable. That is where we need to prune. That is where we need to cut. Because, Mr. Speaker, if we do not deal with the perverse influences, the perverse advertising, and the perverse glorification of alcohol and cigarettes that we see in mainstream media, our children will find themselves enslaved by it. Mr. Speaker, regulating morals is extremely difficult. What some countries have done is to try to ride the tiger. And Mr. Speaker, there is an ongoing conversation now related to what we are discussing on a policy for regulation and control and distribution of alcohol in this country. Mr. Speaker, we have seen a lot of proposals coming up that will make it very, very difficult for young people to access alcohol and for alcohol to be widely accepted. But, Mr. Speaker, let us be fair. Let us be honest with each other. If someone at 18 is mature enough to vote, then that person can make other decisions in their lives. If you're going to be pushing these ages higher, then you'd rather say that you start voting at 21, you start driving at 21, because that is the age where you can have alcohol or you can have nicotine products. We must be careful around these things. And Mr. Speaker, certain countries have built entire economies on some of these products, of course, ensuring that there is quality and there is consistency in their production. Mr. Speaker, Cuban cigars are very famous, and they fetch good money. They built a brand around it. But building a brand around it does not mean that it is abused domestically, because a Cuban cigar is so expensive that an average Cuban worker cannot afford it and cannot smoke it for leisure. So it has been positioned as a luxury product. Other countries have done similar with alcoholic products. Mr. Speaker, the French have their cognac, and they talk of cognac diplomacy. When you meet a French diplomat and you are given the choice between cognac and scotch, they will insist on cognac because it tells the story of the French. They have their champagne that only comes, the grapes come from only one part of that country, and they have made it to become a luxury product, not accessible to the hoi polloi, but they sell it to us. They sell it to the upper classes of third world countries. When you go to Scotland, the Scotch have their Scotch whiskey, and they have branded it to an extent that one would want to drink the oldest. Mr. Speaker, you find someone drinking a 50-year-old whiskey, and themselves are not even 50 years by age, because it has been branded, and psychologically we have been made to believe that this is it. When you have made it in life, you should not be drinking 12-year-old whiskey, you should be drinking 50-year-old whiskey. If you go to America, they've got their bourbon. Mr. Speaker, even our neighbors, Uganda, they've got their waraji. Tanzania, they've got their konyagi. Nigeria, they've got their ogogoro. And you can scan the entire world. Jamaica, they've got their rum. Certain countries like South Africa are famous for their wine that comes from the Stellenbosch region. Mr. Speaker, we must mix, we must blend between making sure that we build products that can build our economy, but also ensuring that the adverse and perverse effects, our citizens are shielded from it. Mr. Speaker, I know that you are a man who loves literary works, and I want to invite the House to read a very interesting story by Leo Tolstoy. It is entitled The Imp and the Crust. Leo Tolstoy tries to tell the story of how man discovered alcohol. It is not a very nice story. And it is a story that says that the devil came to enslave man. And that is why the story is entitled The Imp and the Crust. Very, very interesting. And I want to encourage even the children who are in the gallery to read that story. You will realize that things like alcohol, things like cigarettes, perhaps are inventions of the devil, intended to enslave us and intended to keep us in a state where we are dazed and we are not able to work hard and we are not able to praise and give worship to God who created humanity. Mr. Speaker, let me finalize by saying that sometimes when we do good regulations like this or good laws like this, we then provide an opportunity for rent-seeking for the enforcement officers. Mr. Speaker, we have seen some things that happen at our airports. Immediately, we pass this law. I am sure that some rogue customs and border officers will be asking tourists to open up their suitcases. And if they find a vaping device, then they will use that to seek rent. We have seen where counties have come up with alcohol restriction laws. I think Nairobi City came up with certain tobacco restriction laws. Mr. Speaker, they went ahead to deploy plainclothes policemen to walk around and to frustrate. If you're found somewhere with a cigarette, they would handcuff you and they would demand some bribe from you and they would generally embarrass you. Let us make sure that enforcement of these regulations and enforcement of this statute does not open another backdoor for rent-seeking, for opportunistic behaviors from our enforcement officers. And Mr. Speaker, let us also allow county governments to be in this space because the fourth schedule of the Constitution makes things like tobacco control and liquor licensing to be a function of county governments. All these policy directives coming from NACADA, coming from the national government, must be owned and must be bought into by the county governments. Mr. Speaker, this is a good innovation. This will protect our young people from the adverse effects of these devices. And Mr. Speaker, we must support this, but we must fine-tune it to ensure that we are not trying to regulate morals. We must deal with the root cause that drives our children into tobacco abuse, into alcohol abuse, and into drug abuse. I support, Mr. Speaker.